This year, Walmart Health announced the launch of, as President Sean Slavinsky said, a super center for basic healthcare services. Well, guess what? We are going to go behind the scenes with this dream team to give you all the details and a glimpse into the future.
What if we said the current healthcare industry offers a bad experience, and that for many busy families lacking adequate medical, dental, and vision insurance, it's basically broken? Well, it is. Doctor visits impact everything from time to family budgets to an overall sense of well-being. 1 in 4 busy families worry about the cost of a doctor visit, and at least 1 in 3 don't seek care at all because of cost and complexity. These families need a healthcare transformation that impacts cost, convenience, and care without sacrificing quality. But what can Walmart do to help? We have a vision to deliver a customer-driven care experience that values time, money, and well-being. And how can we do this? By listening to our customers and removing the friction points that keep them from seeking care when they need it. Introducing Walmart Health, a new offering that brings services like medical, dental, and optometry together under one roof. Walmart is proud to bring together healthcare providers committed to delivering a care experience that values time, saves money, and offers a higher level of well-being. This bold vision of solving busy families' biggest care needs also reinforces the Walmart brand promise to save money, live better, by making healthcare affordable, easy, and caring. Multiple same-day appointments will help busy families get more done in one visit, with convenient locations and hours to better fit their schedules. We will build an integrated in-store experience that seamlessly connects all our services under one roof, with a streamlined digital experience that includes easy scheduling and check-ins, plus the goal of transparent pricing, so they'll know upfront what they're paying for the appointment. Providers and our associates will enrich the customer journey by being friendly, respectful, and customer-focused, assuring that customers know they are getting care from people who actually care. And with the convenience of this health center being connected to a physical Walmart store, we can also help busy families get more done on their visits. If we can get it right for our customers by offering affordable, convenient care all under one roof, Walmart Health will help create a better healthcare experience for everyone.
I'd like to introduce you to Sean Nason of Mophie, who will be leading this session. And as he loves to say, no one came to the party for the mild salsa.
Thanks, Jill. Good morning, everybody. Okay, that was really weak. Good morning, everybody. Thank you for being here at 8:30 this morning. We thought we might sleep in, but we decided we would come this morning. We heard a lot of people wanted to hear some great things. Again, as Jill said, I'm Sean Nason, CEO and founder of Mophie. We have been the primary partner with Walmart and this amazing team over the last 18 months almost. And we're going to talk about some great things. I have some amazing colleagues and friends on stage with us today. I know a lot of you were coming today to see Sean Slavinsky, but he doesn't spell his name right, so they didn't let him in the room today. So you got Sean Nason instead. Sean had a family emergency and couldn't be here today, so he sends his regards and wishes he could be here with us. But I want to introduce some amazing, as I said, colleagues, but most importantly, friends. First off, I'll let her give you a little bit of background. I'll share something because she'll never share it. Amber, 2006, Miss Arkansas, went to Miss America. And so Amber, share with us a little bit this morning about yourself.
That's a nice surprise this morning. Thank you for sharing that. A lifetime ago. Good morning, everyone. I'm really grateful to be here today. It has been absolutely the most incredible journey. that we have been on together the last several months. So just a little background, I've worked for Walmart for 8.5 years. So I'm a pharmacist by training, so spent a lot of time in the healthcare field for about 15 years. And really jumped into this project, this initiative last January. So coming up on a year being involved in Walmart Health. And so it has just been absolutely a life-changing event for me to see how we have been able to create an integrative care model and come together, work as a team. And we started that in Dallas, Georgia. Opened September the 13th, Friday the 13th. We didn't think, we planned it like that. Friday the 13th, and we hit the ground running and have been caring for thousands of patients since. So really exciting. Glad to be here.
Yeah, and Amber leads all the operations piece of it and the staff.
So I lead Walmart Health operations and also help to project manage the project from the very beginning, from when we decided, it was written on a piece of paper, and we decided, okay, and make this into a model, actually a model where we would attach it to a Walmart and create what services would be coming out of this, and then worked alongside Matt to create an experience that would be life-changing for patients, but also then for our staff, our clinicians, and our associates that would be working in the space.
Awesome. So. Thanks, Amber. And closing us off here with introducing himself, Matt Perry. Matt's from Texas. He's going to...
Yeah, I was Mr. Texas 2015. Just I don't like to talk about it in public.
Yeah, he keeps it kind of low, too. So Matt Perry, again, a friend and colleague of ours. Matt, share a little bit about your experience and your background in Walmart.
Thank you. So I've actually been in Walmart for 5 years now, and I come out of the kind of customer experience marketing space. Prior to that, I was in Procter & Gamble for 15 years. And I think, as Amber said, this has really been the most incredible journey. I hold my hand up. Until 18 months ago, I had no healthcare experience whatsoever. And actually, that was quite deliberate by the leaders that chose me for this, which was a great honor. Actually, what we've done is not that different to what Mr. Sam did back in 1962 when he started Walmart, which is, we are improving access and availability for people and bringing a product that people desperately need. Healthcare in the US is just too hard for a lot of people. We talked to over 27,000 customers over 6 months, and what they kept telling us was it's too expensive, it's too confusing, it's too complex. And that's the sort of thing we at Walmart love tackling. We love swimming upstream. We love coming at things from a different angle. It's what Mr. Sam built into us. So it's been a phenomenal journey in partnership with numerous people, not least Mr. Nason here, to really build something that is making a difference in America today.
Yeah.
Just when you were talking about really making a difference, so, you think about how do we improve access to healthcare? So that was one of the things that really we were trying to focus on. So 3 things we've been focused on: quality, access, and the convenience. And so when you think about a Walmart, like, what better place? Because we do have within our motto that we want to save people money so they can live better. Yep. And that also includes living healthier lives.
Yes.
And at Walmart, 90% of Americans live within 10 miles of Walmart in America. And so we have really had the opportunity to impact patients and to provide a convenient, improve access to healthcare through our Walmart Health.
How many of you guys knew that 90% of America lived within 10 miles of a Walmart?
You're good students.
You're good students, great. How many of you have heard of the Walmart Health Initiative in the room? How many of you are surprised that Walmart's entering healthcare? Yeah, raise your hand, right? No. And I'm going to ask probably the question, the first question here in a minute. But I think there's some statistics in the healthcare that you need to understand of Walmart is today 4,800 community hospitals in our country. A little over 5,200 Walmarts. So, and community hospitals are closing constantly, and you have to think back to what you were talking about with the motto of Mr. Sam, right, Matt, that totally he wanted to provide access, and so in the areas that they went. And so the first question I'm going to ask them, let them both answer, because we get this a lot, is just why Walmart?
Well, let me go first and I'll let Amber answer. So the interesting thing is actually Walmart has a rich heritage in health and wellness. People just don't realize it. You know, we opened our first pharmacy in 1971, so we've been in this space for 40 years. Right now we have 5,000 pharmacies. We have nearly 3,000 vision centers, 20 clinics. We run 4 times a year a health and wellness event that has provided close to 64 million health screenings since its inception. So we've actually been in this space for a while, and we've heard customers, and we've heard how hard it is for them. They use over-the-counter products in Walmart because they can't afford healthcare. The $4 generic program, really made a difference in that space. So we actually have had a heritage and a place in here. But what our customers told us is they need more. Everyday routine healthcare, doctor visits, dental visits, behavioral health, is too expensive. They don't have the access. And so, for us, we have, as Amber said, 90% of the population live within 10 miles. We have 150 million customers every week walk through our door. We do nearly 425 million prescriptions a year. So we think, if there's one thing Walmart can bring, it's this scale. It's the understanding of how to connect with customers and really bring that mission. So when you talk to our customers and you hear the need out there, you combine that with the scale Walmart has. It wasn't that hard for us to start thinking this is a logical place to go.
Yep, Amber.
Yeah, you say it exactly, that's exactly right. On top of that, we have a desire and a relationship with our patients and a desire to help to expand access, and then also the convenience piece. So you think about our 24-hour Walmarts, not just about the location, but then the time. And so we have expanded hours, not 24 hours, but we have expanded hours. So Monday through Saturday, 7:30 to 7:30, and 10 to 6 on Sundays. And so you can, for me personally, I'm a working mom, I have 3 little children, and it's so convenient for me. When I think about getting care for my children or getting care for myself, I can set up dental appointments, go see the optometrist, primary care, yearly checkups, immunizations for my children, and do it all in one day. Maybe miss one day of work or maybe not, because I can get that same care on Saturday or Sunday. So we see this as an opportunity to bridge healthcare and provide it every day of the week, and it costs the same amount if it's on a Saturday or if it's on a Monday. And so at the heart of our customers, that time-sensitive, busy family, which a lot of us fall into that category, we can really tap into that group of that population and make a huge difference.
Yeah, I think you said it really well. As we built this and we listened to customers, they really asked for 3 things. They asked for us to bring a transformation in cost, a transformation in convenience, and a transformation in care. And it really is, they want all 3. And so, when you dive into that, you find out today, it's not just the absolute price people are paying for cost, it's also the transparency. I suspect many of you have been to a doctor and actually not had any idea how much it will cost, or got a surprise bill a few weeks later. And our customers talk about that all the time. And then, as Amber said, it's the convenience. Yes, we have our locations, but it's the hours. My dentist at 12 o'clock on a Friday is pretty much done till Monday afternoon again. And so if you're a busy family or if you're a working parent, it's really hard to get to the dentist. But the most important thing as we did this is really the care. And actually, that's the thing I give Sean and his team and Mr. Slavinsky something that they've really driven, which is they will come for the price, but they'll only come back for the care. And it's something we've architected into our model from day one. Friendly associates, really, a caring environment from people who actually care. Quality care, trust, credibility. It has been one of the cornerstones of the model that we built.
Yeah, there's so many things they're talking and we want to touch on, and we don't have 2 hours to talk about it. But a couple things, and Amber mentioned this in the very beginning, and Matt hinted to this, and we'll dig into this. 27,000 customers. Over 6 months was talked about before the strategy was finalized, because Sean Slavinsky's philosophy in this was that we would start with the patient first and build back, and the model would be built with the patient in mind. not with the healthcare system in mind. So everything we have done has been for the patient and not the traditional healthcare model. And Amber has been a huge part of that. And she kind of mentioned this, and they both did, to understand that, Amber, will you talk about the services that are offered today, and some of that, and then also on top of that, I think you really need to understand this they need to understand the price transparency.
Absolutely.
And I know you've got a couple stories that we can share,
Sure.
but that would be great for them to hear.
Yeah, okay, so we've actually, you think, okay, we have all these health services out in the community, but to put them under one roof is actually a huge feat. That we partnered very closely with your team to create that ways of working, that experience, so that when someone walks in, that we help them navigate their healthcare experience seamlessly, providing that white glove experience. So when you walk into Walmart Health, yesterday we were talking, yesterday whenever I was here for Katie's speak with Maria, she mentioned about her experience in healthcare, if you were here yesterday, and about how just overwhelming it is with the paperwork that you have to fill out, and how do you even know where to find a provider, or who do you go to? And so what she said was just really hit it home for some of the things that we really focused on with Walmart Health is creating a paperless experience, using technology, using trusted partners to come to help us to create a seamless experience for the patient. So when you walk in, you can receive the services, you can behavioral health, so we do counseling services, primary care, acute care, labs, x-ray, audiology, optometry. We also have wellness services. So we have exercise classes, meditation, diabetes education. That's such a huge, important piece of this puzzle, is to focus on that preventative care and the education pieces. And that's something that we've really, really focused in on for our patients. And so with all those services, one thing that I have loved about this is the feedback from our clinicians. They absolutely love the integrated experience and having at their fingertips the ability to care for patients, to work across business lines, to care for patients. If someone goes in to see the dentist and there's something they need taken care of, they can actually, in a primary care, they can actually collaborate together. And so those moments and the stories from patients and the clinicians alike have been life-changing. A lot of that, people don't realize there's so much that's gone into it with your team and our ways of working and how we have created a seamless patient journey experience, which also begins with a clinician's journey.
Yeah, how many clinicians are in the room? How many of you would love to not have to do administrative tasks and just be able to care for people?
Two hands went up in the back.
Yeah,
I liked
Amber, right? So, and that's what Amber's talking about. The clinicians, our doctors, our nurse practitioners, they're focused on care. And this is all public. You can see the price transparency.
Oh, yeah.
Behavioral health, $1 a minute. So you can get a full therapy session for $60 for an hour.
Yeah, absolutely.
Teeth cleaning.
So we have a family that came in the first week, and it was a mom with 4 children and uninsured. And so we take insurances, we take care of the uninsured, we take care of the underinsured. There's a large percent of the population that are underinsured. And so we had a mom that came in and literally with tears in her eyes and said, I've never been able to take my children to the dentist, much less get my own teeth cleaned. And then I haven't been to the doctor in 5 years for a checkup. So she came in, was able to get her children's teeth cleaned, x-rays, starting at $50 per child, and then was able to see a primary care physician and was actually diagnosed with diabetes. And so she had been living life for many, many years and been able to help to diagnose that and provide that care for her and then have that follow-up is really life-changing. And I think just being involved in healthcare for so long and being able and seeing the barriers. I mean, if you're a clinician, pharmacist, doctor, a nurse practitioner, there's so many barriers in healthcare. Yeah. And so being able to see us break through some of those barriers has really grateful for that.
Yeah. Thanks, Amber. Matt, I want to dive in because I do think we're here at CES, Digital Health Summit. Technology, the powerful thing with Sean Slavinsky leading this helm is he talks a lot about high tech and high touch. Actually, he says high touch, then high tech. That technology is our enabler. It's not our answer to this. So I remember it was probably the beginning part of 2019. I got a call at 5 a.m. in the morning from him. And he said, I need you to focus today with the team. He knew we had a team together. And I need you to create a white glove experience that does not have technology involved in it at all. And I remember walking into the room, Matt sitting in the room, and several others, and said, okay, you guys, we got a new mission. We need to create an experience, a seamless experience for the patient that's no technology, so we can lay technology on it. Matt, you want to talk about what that day was like wicked for all of us, right?
Yeah,
but in 8 hours, we actually did it, a team of us.
We did.
And I know that's kind of your sword to die on now.
Yes.
As we move forward. You want to talk about that, Matt?
Yeah, I remember the call at like 5:27 after you finally got off the phone. Like, Matt, the whole day's changing. Here's the thing. You know, you're absolutely right. And one of the things, you know, to jump to the end, the output of that was this concept of what we're calling a care host. And this care host literally stays with the customer from the moment they walk in. They're greeted by a care host throughout the experience end to end. But you make a really important point. So when we started that day, it was how can we deliver a seamless experience to them if all technology are taken out? Now, that's not to say we don't value technology and don't have technology. We do, and it is improving the customer experience every day. You know, you can schedule in under 3 screens and under 10 clicks, which if any of you have tried to go schedule at your doctor or your dentist using their digital technology, I bet you it takes more than 3 screens and 10 clicks and about 4 fields to fill in. But we had to focus on delivering a great experience for our customers that was there with them throughout the whole process. So we created this post called a care host. There were a number of pieces that went into that. You know, we spent a lot of time looking at, you know, one of the great things customers have in this space is something called liquid expectations. I love that phrase. They will go to Disney or Chick-fil-A or Southwest and see an amazing experience and expect that carried across. So, you know, when we created this care host, it was the little things like we created this thing called the language of care, which was how they talk about it with, you know, a number of our partners, not least Linkwell Health. But we created this whole thing called language of care. We talk to we work with the care host on how they transition. We work with them on how they greet the customers. And so we spent that day, and by the end of the day, we had built a model that really lived our pillar of care without actually any technology needed. Now, there may be a lot of scurrying in the background with pieces of paper and duct tape and things.
That's
working.
Amber's job to me.
That's Amber's job. I don't worry about that. We set the true north.
Yeah.
But it's made a huge difference because we had stories from customers coming back in. I never expected this experience in Walmart. You have blown me away. Because again, people will come for the price, but they'll only come back for the quality of care.
They would even say, I've never expected this experience from healthcare.
Exactly.
Yeah.
So,
That's that liquid expectations piece.
Yeah, and honestly, Matt has been so brilliant around developing that language and what that experience looks like. Mm-hmm. And then we continue to, it's evolving.
Yes.
So as we walk through the space, and we have prototypes, like we're going to open another one in a few weeks, another Walmart Health, and so the layout's a little different. So he continues to evolve and work on that model so that it's something that whatever you're coming in for, whatever appointment you're coming in for, you have that same seamless experience.
And I know you want to ask me the question, but I've got like a 10-second thing to say. The other thing that we haven't touched on, but I just want to make people aware is not only did we talk to 27,000 customers, we also talked to about 700 associates. And we're very proud of what we're able to do for our associates in this model. Whilst it's $40 for a primary care visit, it's $4 for associates for any medical visit. So we're opening access to our own associates, and that has huge benefits, not just for our associate base, but for our whole business model.
Yeah, and Walmart employs 1.1 million.
1.3
million associates in America. So imagine how that could transform. Matt, I want to dig in, and then we do have a little surprise for you guys here, another video at the end. We dig in, Matt talked about this concept of language of care that actually goes into a huge program that was created within Walmart Wellness called Moments of Care. And to give you a complete understanding of that, we built a partnership around what's our common goal, our common purpose, so everyone within Walmart Health, everyone within Walmart Wellness knows that And in 5 months, 5 months, we trained 80,000 associates on what this Moments of Care program is. And so Matt, you were hinting at it, but that's a huge feat. Any of you tried to train 80,000 people in 5 things? Yeah. Yeah, I mean, it's
that was our night job.
Yeah, that was our night job. Yeah, that's right. And even as Amber just mentioned, the next clinic is opening at the end of January. And that staff yesterday and the day before actually went, this is how it got prioritized, went through Moments of Care and Language of Care as their first training.
As they completed Welcome to Walmart.
As their Welcome to Walmart, not the clinical, not the technology, but that aspect around experience and care.
But Sean, just very quickly, this isn't rocket science. I bet there's a lot of people nodding their heads here. And, we actually went back to what Mr. Sam built. When Mr. Sam built his model, he put 2 things on his supercenter. He said, we sell for less. Price is core to the Walmart business model, but satisfaction guaranteed. And he built in what he meant by satisfaction guaranteed was unparalleled customer service. And what I've learned coming from outside of healthcare is I'm yet to meet a healthcare professional that doesn't want to care. These are the most caring people who genuinely want to improve people's lives, who want to improve care. They want to care for patients. We've just made it too hard as an industry and put too many things in their way, bureaucracy, HIPAA, all of these pieces, administration. They want to care and they want to deliver exceptional care. And giving them permission, like the Moments of Care program. When we gave our associates permission you've got to do the safety compliance, we know that's core. But you now have permission to care for your parents, to go above and beyond. Doesn't matter if you don't get every single task on your list done, care for our patients first and foremost.
Absolutely.
Yeah, and so set the stage for this last thing. I think people say, so why Walmart? What's truly the disruption? I would tell you from someone that's been working with them, but has been in the industry for a long time, that the disruption is that we actually put the care back in healthcare. And that we lead with that first and foremost. Purpose over task, you'll hear the teams talk about. And so to give you a little stage set, September 13th, Dallas, Georgia. If you ever get a chance to go to Dallas, Georgia, just northwest of Atlanta. 10,000 square foot facility built onto a super center. And the next one's getting ready to open in about 3 weeks, just north of that. But want to show you Walmart Health. Want to take you on the tour of Walmart Health. Matt, Amber, thank you. We'll be taking Matt and Amber with us and some of the partners that have been working on this journey with us down to the exhibit hall. We have a space right as you go in the door there. Mofi does. They'll be there to answer some questions this morning and to talk with you. But thank you guys for coming in this morning and sharing with us. Jill.